Welcome, guys. This is Motivate OTs, and my name is Tongai Chichaya. I'm a senior lecturer in occupational therapy. As some of you might already know, we are on a new series where we are inviting OT thinkers or leaders in our profession, people who have made a difference in our profession, not only in their own countries, but internationally. And today, I'm so honored to be joined by Dr. Hanneke van Bruggen. That name might not be new to many of you if you are a true occupational therapist. Right. Dr. Hanneke van Bruggen is, as many of you might know, the former executive director of the European Network of Occupational Therapy in Higher Education. And I'm also glad that not only is she the former executive director, but as we talk, the European Network of Occupational Therapy in Higher Education have actually introduced the Hanneke van Bruggen Lecture in her honor. And I think this was since 2010. So that's really impressive. Apart from that, Hanneke van Bruggen is also an adjunct professor at Dalhousie University in Canada. As if that's not enough, she has already received 3 honorary doctorate degrees. I hear the 4th one is coming, so that's really fantastic. And I've known Hanneke van Bruggen some years back now when she was doing some great work in Africa. And today we're going to be discussing about working for justice. But before we get into the discussion, I'm going to allow Hanneke to introduce herself. Hanneke, what a pleasure. Thank you so much for coming.
Thank you, Tongai. I find it an honor to speak with you. I have learned you some years back in Africa, and it was always a joy to discuss with you about justice. Well, I started my career in 1969, so I'm now more than 50 years an OT.
Wow.
And in that time, it was, of course, a diploma course. And I started my work in rehabilitation, physical rehabilitation. But after 3 years, and I had set up already my own department, but I was very disappointed in the profession. I found it very mechanical and not really contributing to inclusion or justice or participation. So I left my country in 1971 to work in Kenya for the International Labour Organization. And I worked there about 3 years, and that has changed my life, my vision, and everything totally. For there, in that time, there was already, the policy was inclusion of persons with disability. And every year, I had to make sure that 200 people either got work or were self-employed.
Wow.
So that was a big amount. And I could see they had a totally different vision from what I had learned in my course. My course, that was making people as normal as possible, and then maybe you could work. But actually what we did, full-time, we excluded people. While in Kenya, it was first thing, give people, solve their occupational needs, make sure that they can eat, drink, do what they need to do, marry, dig the shamba, etc. So that was the most important. And so I could see really justice for persons with disability. So there started my obsession of changing the curricula in the North. So when I came back, I went to education, and I had two visions. One is bring the diploma course on academic level, and secondly was justice.
Right.
Make sure that there's emancipation and empowerment, really empowerment. Well, that has been my whole life a struggle, for sure. When I was back in the education, then finally in 1989, when the wall falls from Berlin and East Europe become part of Europe, I really had the vision, in communistic countries, really disabled people are discriminated fully. So we need to work with them and give them the chance also to make justice. And that has been my drive in becoming first the chairperson of COTEC, the European Council, and later on I thought, we still need to change education for the whole of Europe. So then I started eNote and went to all the Eastern European countries where I have, together with them, established 10 occupational therapy schools.
Wow.
Which all started from the vision justice. But unfortunately, I still have to fight that not this expert medical domination is coming in. Or I see it everywhere. Oh, please give me a method so that I can treat, always the impairments and treat these people. But treating people and sending them back to the situation that makes them sick will not help.
It won't help. Yeah.
No. So, yes, it's still a fight, but some countries really understood and made quite a different OT education than what I saw in the Netherlands, the UK, etc. But slowly you see the influence from that Eastern thinking came to Europe. So I still think Europe is in a transition from more to more social side of the profession. Still not enough. Still not enough. Still we think we can dominate everything. Yeah. So until now, I'm working on transition. So from eNote, then we started about 4 years ago a new network, International Social Transformation Through Occupation.
Wow.
And that is where I'm now a bit active, but actually I'm retired, so it is not so much.
Oh, thank you so much for that. I mean, the work that you are doing or that you've done, I mean, it's massive. And I'm actually inspired by the drive that you still have for this work. Now I'm moving on to my next question. Maybe there are occupational therapy students or other occupational therapists who are saying, wow, Hanneke, what you're talking about sounds interesting. But what exactly are we doing when we say we're working for justice as occupational therapists or we're working for inclusion?
Yes, well, that is really a different approach. As I said already, the World Health Organization is calling already since 2000 2007, please focus on inequalities, on the social determinants of health.
Yeah.
So start your education with looking what is poverty and how is poverty and disability related and influencing each other. And how do we assure that people really participate? Not by making them first as normal as possible, and then maybe as a second-hand person he can include. No, with respect for the person with his disability and real participation. And we say as occupational therapists that we are the profession to make sure that people can participate. So then focus on participation. But still I see we focus mainly on those with a disability. But actually when you look at inequality in the whole world is still growing. The gap is growing. Not because we have more persons with disability, yes, also, but we need to make the other side aware that they have to change. So, and that is very difficult for students to handle. So if we really, I can give a simple example of my work in Georgia.
Yeah.
Where I started in 2003 and I found out that the law, so the first thing is look at the bigger picture, what is here the system? And the system says children with disability cannot go to school, is forbidden by law. Okay, if you know that, what are you doing then if you get a mother with a child with disability and the mother thinks, oh my goodness, she is already 7, she needs to go to school. And the occupational therapist did first all kind of sensory integration. Of course, that can take years and the child will never become normal. So I said that's the wrong approach.
Right.
The mother needs, first of all, the mother needs time to work, for she is a single mother and has a child and is quite disappointed in OT when she sees, okay, this can take years. So strengthen the mother, find other mothers, make a social movement. And finally, we changed the education. And that we did in 1 year. So the mother started with a little group where she learned to handle the children, each of them worked 4 days, and the other day they took care for the children. Right. And then I asked the mothers, find a school who wants to work with you on inclusion. Each of them found a school in their neighborhood who was willing. But of course, then it is not, the school cannot just start. There are other parents, so here's the other side. They have a lot of resistance. No disability child in my school. No. So we did sensitivity, evenings, meetings to sensitize that group of parents and that group of children. And we worked with teachers who really wanted. So finally we had a bigger movement of 3 schools who said, we like to be a pilot.
Wow.
Then don't do that in a corner. No, for then the ministry will come and say, hello, what are you doing? So we said we go with this whole group, 3 head of schools, teachers, parents, everybody goes to the government and we say, you have signed the rights for the Convention of Children with Disability.
Yeah.
They have the right to go to school. How are you going to do that? We don't know. So we will try. Can we do this pilot? And if we do the pilot, then we want to change the law. And so it happened. We did this pilot. It was so successful that the ministry said we need a policymaker for inclusion of all primary education.
Wow.
And who became that? My first occupational therapist.
Wow.
In
Wow.
that country. So starting from this side,
Yeah.
and not in a corner with one mother and one person with disability. No, system and change. And then the ministry said, give me 50 more of these people. So it is where you start, where you see your chances. And that is working on justice.
Wow.
And it makes immediately the profile of your profession so much bigger than just, oh, that is that person there in the corner in a hospital or sometimes in a cellar, how I started. No. These are people who can really make change.
Wow, wow,
Yes.
wow. That's really impressive. I mean, I really like this approach of looking at the population and then looking at systems. How can the systems be adjusted so that they are inclusive rather than focusing on individual service users?
Yeah, and making the environment ready to do.
Yeah.
For you cannot just include a person. There is a lot of resistance against disability, against Syrians, against whatever.
Wow, wow. Now this takes me to my next question. I think you have touched already by the example that you gave. You've already given an example that other occupational therapists can actually see how this advocacy work can actually bring results. Now, I want to ask you about the future of our profession, the future of occupational therapy. How do you see our future? Is this the future that you would want to see? Are there things that you think, as a profession, we really need to tackle? Do we have any white elephants in the room?
Well, I think still that in the education, there's still too much medical expert thinking, too less relevance of the teaching, that we really teach about these inequalities. And what is for me still in occupational therapy, we have really to decolonize education. That it is really, education should be a transformative space for individuals and societies.
Right.
But education is not this transformative place. It is too much regulated. If I see research, I get sick of how people become a doctor. And finally, for society, where are they? Come on, do something. And yes, everybody says always, oh yes, all these inequalities, and we can see the climate is changing, but we have to work to collaborate, make collective actions, collective occupations. So really, if we want to exist, even if you work in a hospital, I see so many people just working till the door. So, okay, we could have done with this child in Georgia, sensory integration every week. Fine. And then the mother was hopeless and the child should never go to school. So our responsibility is participation, and not till the end of the door of the hospital. No, participation in society. So make your networks, even if you are not allowed to do it. Then make sure that you find their ways that they really are supported.
Wow.
Many people don't do that. So what I do with my students, I have one whole year in Georgia. So we really start to make a little project, but really go to the end and try to make a little movement.
Right.
I'm still struggling with standards. How much standards do we need? Yeah. Of course you want quality, but yeah, quality in one country is not the same as in another.
Yeah.
And the same is with human rights. Yeah.
Yeah, there's talking about quality, especially in education. I know you have been involved with the tuning project or academy. Can you talk a little bit about it and how it might help to achieve this vision of working for justice in occupational therapy?
What is the most important also in the world is that we understand each other, that we have dialogues, but everywhere things are not any longer in dialogue. We just fight each other and have conflicts. Well, the war is a typical example of that. So, but the tuning methodology was really to understand each other language so that we have a same idea. Okay, this is about the frame of how an occupational therapist could look like. But then each country can still, should talk about the same language, but they can say, we want this, that competence. We think that in our situation, that is more relevant. And so you give people the freedom, you don't make them all the same. That is not the idea. This idea is to have a frame of reference so that you have an idea when one person comes from Bulgaria to the Netherlands, okay, they have these competences, but miss the ones that we want. And then you can ask them to do that 5 competences.
Oh, I see. Yeah, for the purpose of our audience who might not know what you're talking about. Yeah. So the tuning project was looking at harmonizing occupational therapy training in the European countries that you've mentioned. But I also understand that it went over to Africa as well. Yeah,
Africa. Well, the tuning is it is of course from Europe. When Europe became one, we became one education area, but all the systems are different. Well, still UK is still
Brexit
has their own rules. But so then at least to speak the same language, this was necessary. And I have done a lot of research also in Africa, in Ghana, Malawi, and Kenya. And so they do it for all disciplines. So medical doctors, nursing, whatever. And then in Europe, we were also part of a cross-disciplinary framework, and that was the social framework, where humanistic disciplines were in, and yeah, a lot of psychology and even business. But you could nicely see where were overlapping competences.
Okay, I see.
But now I just heard that eNote is going to revise the whole tuning framework, and tuning also want more quality.
Probably as we wrap up this discussion, I know you are involved with an organization, facilitation and participation of disadvantaged groups, and you've done projects in many places, and you support occupational therapists, you support occupational therapy students. Can you talk a little bit about that?
Well, I'm mainly with that organization involved in 2 projects in Kenya. One is in the slums, working originally with one child or grown-up adolescent who was herself a street child, and she asked me to support her, and that I've done, and that has been so successful. I said to her also, start a community organization, make yourself stronger, make yourself a movement. So that she did. So she has an organization. We have built a school.
Wow.
And about 300 kids are there.
Wow.
Many do primary education, but we have also a lot of vocational training, income generating, teaching parents, teaching persons with disability. So really trying to develop the slums. And so she also makes connections. I always say network. So she has a connection with 100 men who make beads, and they are buying the beads, and the beads are made to necklaces and earrings, etc. They are sold on the market. So this is a whole chain of growing out of poverty. And yeah, and now we have started a second school. So she came originally from a rural area, and in her rural area just last year we have also now completed a school. Now we are busy with the vocational training.
Wow.
Yes, so trying to really to work with the most poor people, drug abusers, all kind of people.
Wow.
Give them occupations.
Wow. I think these are truly classical examples of how our occupational therapy understanding can actually make a difference, not only to individuals, but to communities.
Yeah, and prevent disability.
Yeah, sure.
Yeah, for if people have food and have work, yes, then they have less chance to become disabled.
Yeah,
I've tried to get the students from the Nairobi school, but they don't want to work in the slums.
I think probably it might be a matter of education and equipping them with the real knowledge that the OT profession is not limited by walls of a hospital or an institution.
No, they mostly work in the hospital. Yeah, where do you want to work, for the rich or the poor? I always say also to my students, if they need money, okay, also take a few very rich patients and let them pay very well, so then you can
help the others.
Yes, help the others.
Right. Thank you so much. Thank you so much, Hanneke, for this talk. And I'm sure our audience will greatly appreciate this talk because it's really, really eye-opening to the potential that we have as occupational therapists in making a difference in communities. There we are, guys. We've come to the end of our discussion with Hanneke van Bruggen. She is a renowned advocate for the occupational therapy profession, and especially for working for justice, working for inclusion. And I've also had a great pleasure to contribute a chapter in the book that you edited, Hanneke, together with Nick Pollard and Sarah. And it's really inclusive, and it's called "And a Seed Was Planted." Where
Thank you. Yes.
yeah. Thank you so much, guys. Thank you. Please, if you haven't subscribed to the channel, go ahead and subscribe to the channel, because there is some content that is only going to be available for subscribers, because we need to reach the people that are really interested in what we are doing. Like the video if you like what we are doing. Share this resource with other people, other OT students, other occupational therapists, or other people who might have an interest in what we are discussing about. So this has brought us to the end. Thank you so much, Hanneke.
Very good initiative, Tongai. Yes, hope to hear more.
Yeah, thank you.
Yeah.
Okay, guys, it's bye for now.